I'm going to try to add him now. Let's see if it comes through. Hi.
Hi there. How are you?
Good. How are you?
Good. I keep typing. I'm here. I'm here.
Oh my God. Honestly, I have only done a live probably one time before, and so I'm really rusty at it. So I was like, how do I do this? I was Googling how I do it beforehand. So
You're doing a great job. I was watching the last couple of minutes, and you were doing great. Yeah, I try to not look at the comments. So when I was saying I'm here, I guess you can get really distracted. Some people have really nice things to say. Some people can really throw you off.
exactly.
But I think that this topic is so important, and I completely understand if Larry wants to jump in and say hi, he's more than welcome to.
Okay.
I think it's a great place for us to start.
Okay.
In the last 6-7 months, we've done quite a few lives with people that's audiences have been incredibly interested in this topic.
Right.
And I have to say, I think it's been very reassuring and eye-opening for people to learn about what we do and what we have to offer for people. So there's a lot to be said, and I really appreciate the fact that you're being really open about this, because so many other people are in your shoes right now.
Yeah, and thank you so much for like being open to doing the live, because I know that like if I'm having all of these questions and like I'm confused about it, I know there's so many other women that are confused with me. You know, and I'm married and 36 and no kids. So, and I definitely want kids, but I just didn't know, like there's just so many questions. I'm just like, am I too old? Am I at a high risk pregnancy now? Can I just do it naturally? Like what's smart? Like what's not smart? Just like so many different questions that I have. And I definitely wanted to share that with everybody else, because I know that they're having those same questions as well. There's he said he's gonna like sit in for a little bit, and if he gets uncomfortable, like if we start talking about things that are too deep for him, he'll exit.
Whatever you want, we're here to help. And you know what, I commend you both for being open about this journey. And you know what, it's all about educating yourselves and learning, and you know, things will hopefully be absolutely fine. I'm really convinced that most people in their mid-30s can still do very well, but it's better to know than not know. I think one of the first things that we should talk about for everyone to know is like, how do you assess your fertility? You know, women, it's great that you have a partner, but I realize that some women that have a partner start ignoring the fact that they need to do it just because they have a partner. Single women, it's always at the edge of their mind, and they're thinking, you know, what do I do? I need to freeze eggs. So it's a little bit more of a prevalent topic when you're single, because you know you have to freeze eggs and there's not that many other options right there.
Right.
I think that for couples, the idea of freezing embryos is something that's a little newer, but I think it's really important to assess what you and your partner want in life, in terms of, do we just want one kid? Then maybe I don't have to kill myself right now, and I'll, you know, start doing this soon. If you want to have 2, 3, 4 kids and you're in your mid-30s, if you don't start thinking ahead about number 2 or number 3, you could have a little bit of a problem moving forward. So it's really smart to address these things now. You can never go wrong by being more proactive and
Right.
learning a lot more about your own stance in this whole process.
Yeah, that's what I was going to ask. I was like, you know, if I'm 36, I thought I was 37 yesterday. If I'm 36 and let's just say I wanted to have like 2 tops. At this age, do you still recommend, like me being married, do you still recommend doing embryos or freezing eggs? Like, or is that only for like, if you want to have like 3 or 4? Like what is a high risk age anyway?
So there's different things to talk about. So one is when to carry a pregnancy, and one is when to make an embryo that's going to make a beautiful baby. Everyone knows in the world of fertility that the younger you create your embryos, the younger you freeze your eggs, they're better quality, and the more you get. So that's one thing that's really important. There's an important blood test called AMH, anti-Müllerian hormone, and AMH has been shown to do really well in terms of predicting your eggs, because it comes from your body and it comes from the eggs. So it's a simple blood test that could be done on any day of the month. It has nothing to do with where you are in your cycle. You can do it whenever you want. And that one simple blood test can be understood by your fertility specialist, or some OBGYNs also know how to interpret them well, but I think a fertility specialist does a much better job to be able to tell you if your AMH is appropriate, if you've got good egg reserve, or if you've already had a decline or even a normal decline for your age. So an AMH is probably the #1 first test that we should be getting on all women who are interested to understand where their fertility is.
Okay. And then if your AMH level is good, does that mean that you still have time, or?
So if your AMH level is good, and by the way, that's that should be started, in my opinion, at 30.
Okay. Oh.
So I like to do that at 30, because once you do that at the age of 30, then you can, every year you go into your doctor's office, you can kind of see it and see how it's trending.
Right.
But I do think that for many women, like, you want to be freezing your eggs when your eggs are good, when your egg reserve is high, and when your body is doing well, and when you have a strong AMH. It's not an ideal thing to do when it's, you know, falling down and it's gone lower. But at the same time, we have a lot of women who are 40 years old and come to us, and they have had a decline in their fertility. So we do tell them it's better to freeze any egg than no egg. And many of our 40-year-olds with great protocols of medications that we put them on these days do very well.
Okay.
So you can still do well. So you finding out where you stand is probably the number one thing to do. And yes, if you're 30 and the number is really high and you've got a great egg reserve, you know, if you don't have to do it at that moment, at least you know you're doing okay, and you could wait a year or two if you needed to. Again,
so at least get checked by the age of 30, at least just get checked. See, I didn't know that.
Absolutely. Absolutely. Okay. It's 100% by the age of 30. It's a great time to check and see how you're doing.
AMH levels. Okay.
And again, it's a simple blood test.
Okay. And can you get that done? Do you have to go to a fertility specialist like yourself, or can you just get that?
You can even ask your primary care doctor for it, or you can ask your OBGYN for it. But many people don't know how to interpret it that well. So in the old days, they used to say if it's over 1, it's great. If it's below 1, it's not great. But I think there's a lot more to it. I think your age has to do a lot with how you interpret that. Because if you're 43 and you got a 0.95, it's below 1, that's actually for a 43-year-old excellent. But if it's 1.1 and you're 31 and it's over 1 and someone tells you that's good, that's actually really low for someone in that age category.
Okay. And that can just be... Go ahead, sorry.
No, I just think the person interpreting for you has to be good at doing that.
Okay. And honestly, nobody's ever brought that up to me. Like when I do like physicals and stuff, nobody's ever said, hey, we should check your levels. Is that something that like is just not talked about and you have to bring that up as a woman?
It's a rather new test. It's come around in the last, I'd say, like less than 10 years. So some docs may not even know what it is. If it's a primary care doctor, they may have no clue what it is. Most OBGYNs, I think, know it. If your OBGYN isn't bringing up your fertility to you and bringing it up to you, maybe you need someone that's a little bit more detail oriented and more involved, because I think it starts with the OBGYN office, double checking to see where you are and bringing up to you. Have you thought about fertility preservation? Have you thought about how many kids you want to have? And if they're not going to bring it up, then honestly, I can't figure out who would.
Okay. Okay. That's good to know. So can you be like completely healthy and nothing be wrong with you, like a completely healthy, like 34-year-old, but then when it comes to fertility, still have issues somehow? Like how does that like,
Absolutely.
How
100%.
does that work if you're like so healthy? Why?
So for a lot of people watching, if they don't know, my offices are located in the heart of LA, where there's a lot of healthy women that are exercising, women that are doing spinning and cycling and yoga and eating well and gluten-free and all the things, the trends that are available. And it's very frustrating when you have someone coming into your office and says that I'm totally healthy and they're 38 years old, but their egg reserve is incredibly low. So unfortunately it happens. So you could be the healthiest person ever, but your ovaries are kind of on their own track to do what they need to do. And for that reason, I think it's really smart, really smart to be very proactive about this entire process.
Okay. And then if your egg count is very, very low and already, like to start with, that definitely, like when you're trying to get good, how does that process work? So like you get the eggs,
right?
There's not very many to start with. I don't know what is not very many. Is it like 5? Is it 3? What's like the...
Well, it depends. If you want to have 4 kids, you know, maybe 15 eggs is not enough. But if you want to have 1 kid, maybe 15 eggs is enough.
Because not all good
It
eggs.
does not every single egg. I want everyone to be aware of this. Not every single egg goes to a live birth. Okay, that's just how women's eggs are made. That's why not every woman gets pregnant the first month, and that's why people have miscarriages. Eggs are very fragile. They're not always perfect. So we always like to tell people that the more eggs you have, the better it is, and the better you can do.
Okay.
And it's just better options for you having more eggs in it, the healthier it is.
Okay.
So that's one really important thing for us. The other thing is that the quality of eggs has a lot to do with your age. But I don't want to discourage anyone who's older not to do this. We have had people that have been very open about it all over social media and the news. They were 43, froze their eggs and came back and had kids at the age of 46 and delivered at 47 and did it unbelievably well. Not every single patient at the age of 43 and 44 have done that well. I had a patient of mine that froze her eggs at 44 and came back and used them. A year and a half later, she sent me a picture today of her 2-year-old's birthday. So,
what?
yeah,
That's
it's so cute. It's so nice.
that.
She was a single woman who was really scared of doing it, and she's came in late in life, and she froze it, and it did well, and she ended up with a gorgeous little girl. So we're really happy to be a part of stories like that.
That is really exciting. That must be exciting for you to see. You probably love seeing like the kids and stuff because you know you had a
love it. Just I can't tell you, every single time I get a message or an email or just someone posting a pic or sending me something to my Instagram, it just makes my day. It just makes my day seeing these beautiful kids.
That is so cute. I love that. So like a woman that's like 40, in her 40s, it's a little more dangerous, like carrying the baby, right? Or is there a certain point, like if you're a month, then you're safe. You're like, is there a danger zone of like where you have to know like for sure if you're going to be able to like carry the baby?
You know, every single person's again different. You could be 30 years old and be diabetic and hypertensive and obese and have fibroids, and all those things are horrible for carrying a pregnancy. I have had people in their late 40s who are in great health, went to their due date and had a beautiful delivery and do really well. So it really depends. I think that being in a good physical shape is very important before trying to carry a pregnancy. I think it involves talking to your general doctor, making sure you're being as healthy as you know you could be and doing everything that you can. I think those things are super important. And I encourage everyone to, before planning on being pregnant, to try to get their bodies where it should be or close to where it should be. And really paying attention to being the healthy you.
And then what do you recommend for somebody that like, when it comes to like preparing your body, like let's just say, you want to have a baby in the next 2 years. What's the best way to prepare for that? I've heard lots of different things. Like I am plant-based, but I heard you have to be on a high protein diet to make sure you're like super healthy. You don't want any complications. So you want to be able to eat the right things, take the right vitamins. So like, do you have any like things that you could just be like, okay, do this, eat this, or take this vitamin? Like,
yeah. So for all women, and if they look on my Instagram feed, it's going to be there somewhere. And we put all of the vitamins that we recommend. So I always recommend a prenatal vitamin. I always recommend a DHA, which is an omega-3. Which is very good for the female body and also very good for the brain development of the child. I recommend also a CoQ10, which is an antioxidant, and that's also very, very important, and it has beneficial effects on the aging of the eggs. If people have low egg reserves, there is something called DHEA. I just don't recommend everyone to take it, and that should be recommended by a doctor. So those are the 4 things that I think are really beneficial for someone who is concerned about keeping their body in a healthy way for reproduction, and also for someone who's actively trying to become pregnant. So those are the 3 things I recommend for everyone. The 4th one, you need to talk to your doctor and see if it's beneficial. But those are the basic things. Now, do I think adding vitamin D? Of course. Like if your vitamin D is low, you should add vitamin D. If there's any supplement deficiencies that your doctor tells you about, this is the time to be on top of it. And if you feel that, just because you're plant-based doesn't mean you're not getting protein. So it's something, and if you're unsure, then you should speak to a nutritionist or a doctor that can kind of give you some feedback on that.
Okay. And then I'm just trying to think because I have a ton of questions for you. When women who are married or longtime partner do embryos, do they also freeze eggs on the side, or is that like not, do they not do both?
That's a really good question. So let me kind of explain to people. You can either just freeze the egg. It's the egg that comes from the woman. It has no sperm anywhere on it, and it does really, really, really well. So that's one thing. The other thing is that you can either take an egg and put a sperm in it, okay, and that's called an embryo. The embryo divides from 1 cell, 2 cells, 4 cells, and it becomes a rather large kind of growth of cells, and that's the beginning of every single human being. We usually like to pick the best sperm. I actually love this picture. This is a picture of us picking the best looking sperm and injecting it directly into the egg.
Oh my goodness.
Yeah, so there's a little something holding the egg in place, and then there's a hollow needle, and you could, if you look really carefully, there's a tiny little sperm in there, and that allows us to pick the best looking sperm and put it directly into the egg. That's called intracytoplasmic sperm injection, or ICSI.
Wow.
So when you make the embryo, you're kind of stuck because you got a sperm and an egg together that are never coming apart together. So you're kind of stuck for the rest of your life with that partner. I like to tell people, if you are 99% sure that you're going to have a child with that partner, you freeze only an egg. If you are 100% sure you're only having kids with that partner, then you can make an embryo because there's no going back.
Right.
So that 1% of doubt, you should cover yourself and freeze eggs for yourself. And if you still want to make embryos with your partner, feel free to do so. But make sure you've protected yourself, because your partner, when he's 40 and 50 and 60 years old, is still going to be making sperm, but you are not going to be making eggs for yourself at that time.
Right. So like what happens if a person's like, I'm 100% sure, we've been together for 100 years, we've been married, like this is it, this is it. And you do all of you do your embryos and then it doesn't work out. Then what do you do?
If you're going to think that way, then every single woman in the world should always freeze their eggs just to be sure that they protected their own fertility. And I have absolutely no problem with that. And I have had many women come in with their boyfriends and their husbands supporting them freezing their eggs for whatever reason may happen.
But you can do both while in the surgery. You can do both?
You can do both in one surgery, but it's only for a particular patient. So if you have a very high AMH that's going to predict a high number of eggs, I think it's a great thing to do. You have to divide them in half. So, going from like 30 eggs, which is a phenomenal number of eggs, and very few people make that many, and making it 15 eggs and then 15 embryos, and then the 15 embryos may lead to a couple embryos. You're going to be declining both of your statistics on both ways. What many people have done is one cycle of egg freezing and then another cycle of embryo freezing. I know it's more involved and it involves doing 2 cycles, but in a perfect world, that would be a better way to do it. Okay,
got it. And then, before I forget, how do you know what is the best sperm? Like what's
That's a good question.
Sperm? Is it like a bigger? Is it faster? Is it bigger?
So there are many things that my embryology team look at. The sperm goes into this medium and it's thick. It's like honey, and it slows down the sperm spinning. How they swim, and how you can see it. And then it goes under a microscope. So my embryologists are able to see, first of all, which sperm is swimming in the best direction, not like backwards, not in circles, but going forward. So that's the sperm motility.
Oh, sperm.
Yes.
Okay.
Exactly. Number 2, and Larry's like hiding in the other room now. He's just like covering his ears.
Goodbye.
He's like covering his ears. He doesn't want to hear a word about it. Which I do have a report that I just saw on my desk that I'll be calling about.
Okay.
Ask him if he wants me to go over it right now, right here.
Okay. So you guys know Larry went and got a sperm analysis, so maybe we should give it on here.
No, maybe we're not. We're definitely. I didn't even glance at it to see if it's good or bad, but I'm not going to do it here no matter what. Okay.
All right. So let's get back.
I'm a little scared of Larry. A little.
Yeah, me too.
We're going to be really nice to Larry.
Yeah.
So we'll talk later. But so the motility is the movement. Number 2, the thing that we look at is to see which embryos are actually looking the most normal. So like you said, like a really big sperm with a really big head and a small tail is not normal. A sperm has a particular look with a really nice oval head, a thin little neck, and a tail that goes very normal. So there are a lot of things that are abnormal with sperm. It's the head size, the tail size, the neck size, and those embryos kind of just go out of the way. Those sperm we just get out of the way, and we pick from the best looking sperm. So to answer the question, we look and find the best looking, strongest, fastest swimmers in order to pick them up to put them into the egg.
Oh, so the ones with like a big head or that don't look right, is there usually something wrong? Like if you an embryo, would that be something wrong with the baby?
It probably will not lead to fertilization.
Okay.
If it does lead to fertilization, the embryo probably won't grow well. If the embryo does grow well and then we put it into the uterus or it happens spontaneously, you're probably going to end up in a miscarriage. And by the way, if anyone ever Googled the abnormal looking sperm, you're going to be shocked what you see. There are sperm that have 2 heads, 2 tails, huge tails, little tails. It's just like the things that you see.
Are you serious? I never knew that. I never knew that before. So like guys, like they can, like when you do I don't know how to say it, but
semen analysis.
Yeah, when you do that, and there's like what, like 1,000 of them, or?
No. Normal sperm has over 20 million per milliliter.
Oh, wow.
So every little tiny milliliter or cc of ejaculation is supposed to have over 20 million. So the average guy ejaculates like, let's say 2 to 3 milliliters, and that's 2 to 3 times 20 million. So a normal ejaculation should have something between like 40 to 60 million. Some guys have hundreds of millions.
Wow.
Yeah.
And so you have to look through hundreds of millions of swimming sperms to like take out.
I'm just appreciative that I'm not an embryologist on that day and I don't have to do that. I go after the egg. So my job is going after the egg.
Okay.
And the way that an egg retrieval happens is, first of all, the way that the whole cycle goes is that people generally have to call us on day 1 of their cycle when their bleeding begins. That's how the first day of your cycle is the first day of bleeding.
Okay.
Because a lot of women think it's the first day that bleeding has stopped, and that's not right. So it's the first day you bleed. We bring you in for blood test and ultrasound.
Right.
And if everything looks good, the average patient will go on a birth control for about 10 days to just stop their cycle so that you're not ovulating on your own. And then at that point, we kind of get your body what we call at baselines, kind of at the resting point. And then we teach you how to give these little injections to yourselves. Some of them are kind of in the form of a pen. You just hold it against your belly and you go like this and you're done. You just dial it. The needles are tiny.
Your belly?
Huh?
Your belly? Why the belly?
That's where it's supposed to go. It's a subcuticular injection and it goes under the skin of the belly.
Oh, okay.
The number 1 complaint we get and call we get here in the office from people is that I'm not sure if I'm getting the medication because people are hardly feeling anything.
Oh, so how do you know if you're getting it?
Because during the next 10 to 12 days when you're actually giving yourself those injections, you're going to be coming into my office probably about 4 to 5 times, and we do ultrasounds and we do blood tests. And the blood tests will show an estrogen level that's going up and up and up. And then the ultrasounds that we do vaginally, and we look at your ovaries, the ovaries have these little bubbles on them. As these little bubbles begin to grow, the ovary gets bigger and bigger until these little follicles, they're called. There's hopefully going to be a bunch of follicles, and each follicle is the casing for one egg. It's the housing of where the egg grows. And by the time they're close to about 20 millimeters, there should be a mature egg. And it usually takes about 10 to 12 days of those injections to get those little follicles until that point.
Oh, wow. So then as soon as you're done the injections and you go in for your ultrasound and you see that everything's working, then is it like you have to get into surgery like right away while?
So usually I will get the report of your ultrasound and I will review them and I will see where your blood levels are. And I can, for example, I'll be like, you know, Nicole, things look great. Today is about day 12 of your injections. And we are ready to give you what's called the trigger shot. There's one final shot you get at the end. And that trigger shot, usually exactly 36 hours later, we take you to our little surgery center where you're going to get a light little in your IV, a little bit of medicine that just makes you relax and fall asleep. You fall asleep for about 3 to 5 minutes and you wake up and the eggs are out.
Wait, 3 to 5 minutes?
That's it. Yeah.
So you don't have to go in taking them out of every single follicle? Like
you do. You do. So there's an ultrasound that goes in. It goes from one ovary, one follicle to the next, to the next, to the next. And there's a little needle in the tip of this ultrasound that just kind of suctions the follicle fluid, called follicular fluid, and with it, the eggs come out and they go into little test tubes, and we keep passing the test tubes to our IVF lab, and we have a little counter. It's actually digital, and it goes like to 1, 2, 3. So I keep looking up to see how many eggs I'm getting.
That is wild. I want to like see a surgery.
we could arrange to show you some video of that. We're redoing our website right now, so soon we're going to have videos from lots of different things.
Oh my God, this is just wild. I never knew that it was like this. Like, this is very interesting. Very interesting. Like,
and
wow.
when you wake up afterwards, like 5 minutes later, it takes you about like 10-15 minutes to kind of come around again. And at that point, we tell you how many eggs you have. The next day, if you're freezing eggs, we confirm how many were mature, because immature eggs cannot be frozen, but the mature eggs do really well and they get frozen.
Okay. And then you're saying frozen for egg freezing, and then but for me it would be.
But for embryo freezing, at that point, the same day and time when I'm taking your eggs out, your partner is going to go into a private collection room and give us a sperm sample. That sperm is going to be washed up, cleaned up, and used to inject individually each sperm into the egg. That's also the time, if someone's desiring to do this and get maybe more male or more female, we also can get the sperm and do what's called sperm spinning. And we spin it for about 4 hours, which kind of separates the male and female sperm, because the XX and the XY chromosomes are a little bit different in weight. Okay. And the female sperm is a little bit heavier and goes to the bottom because it has 2 X's, and that X has an extra little arm to it. And then the male sperm kind of goes to the top. So those are the sperm we can use. It doesn't guarantee you get all male or all female, but it can also push it a little bit more in that direction.
Oh, so some people want to like separate them, but what is like if I didn't want to separate them, is it just?
We don't need to do that spinning process. We just clean up the sperm and pick the sperm, and whatever we get, we get.
Oh, is it very often that somebody gets like all girls or like all boys?
It's not very often, but I have seen it. I have a couple that I love. They had been trying to get pregnant for like over 10 years before they came to me. They made 7 girls. They were happier than anything in the world. They just did not care at all. I know that some guys would have passed out if we told them, but they were great.
Oh my God. So if you sat us down and said we have like 6 girls and no boys, you can't go back and be like, well, can we do the...
You can go back and do it again. That's all you can do at that point.
Wow. So maybe it is better to separate them if you know you want boys and girls.
Well, if you want boys and girls, you should just use all the sperm and not do anything to it.
Okay.
Yeah.
Oh, wow.
Nicole, you have your Wi-Fi is really interesting. Like every few seconds, your face will stop in a beautiful pose.
Really?
Like, and then it comes back again.
Has it been doing that the whole time? Because I'm not.
Yes.
You're for me.
No, like right now you froze again.
But
all the poses have been really good, so you're doing well.
Okay, but it's only for like a split second, right?
For a split second.
It's so weird. The whole time?
Yep, it's happening still.
Shoot. Okay. Well,
it's all good. Every pose has been a great one. Don't worry.
Okay, well, on my end, I'm going to save this for everybody. It's not been freezing on my end, so I think we're going to be good.
Okay, good. I hope so. Maybe it's on my end. I don't know.
Maybe. I did want to ask you, though, how can you tell, like when you have the embryos or the frozen eggs, how can you tell, like, is there a way to tell if the baby has, like, not baby, it's not a baby yet, but is there a way to tell if it's going to be sick, like, chromosome missing, or if there's going to be like Down syndrome?
So yeah, absolutely. And it's one of the most important things that we do in our practice. So once we put the egg and the sperm together, the next day we know if it is fertilized. And then after that, we watch the embryos grow for about 5 to 7 days. By the 5th to the 7th day, the embryo should have divided about 150 to 300 times and have about that many cells. And then those cells basically is what we are using to do a tiny little biopsy on. So there's a portion of the embryo that's popping out, and it's called a hatching blastocyst. Mm-hmm. We take a couple cells, we freeze the embryo. Those cells go out to a special company for genetic testing. The company that we use is called Sequence 46. They're one of the #1 genetic testing companies in the country. And latest, I get a report and it says embryo #1, normal male, embryo #2, normal female, embryo #3, Down syndrome, embryo 4, chromosomal abnormality. All the genetically normal embryos are there for you to use for the rest of your life.
Oh, wow. Okay. Well, that's actually really good to know, because I guess, like, how long has that been a thing? Like, how long have we been able to tell, you know, if there's something wrong?
So that's a really good question. So I have twins that are 8 years old. We had a little bump in the road and we did IVF 9 years ago. At that time, we were doing a biopsy on day 3 of an embryo when the embryo was only 8 cells. And we would take one of those cells out, do testing on it to make sure it's genetically normal. So we decided that it's not that safe to do it that way, even though people did incredibly well and we did incredibly well. I'd say probably about 6 years ago, we decided to start taking cells from the outside when the embryo is popping open.
Mm-hmm.
The portion that's popping open is the overall for how it's amazing. It's called next generation. Very accurate, and it tells us a lot about the health of the embryo, making sure that it's completely healthy. It's about 99.6% accurate. So we have a lot of confidence in putting an embryo back into someone, and we know that it's going to be healthy. And that really reduces miscarriage rate as well.
Oh, wow. Can you also pick up on something like autism?
No.
Okay.
Unfortunately, the only diseases and disorders that we can see are things that are chromosomally affected, and so you can find it on a chromosome. Also, if 2 people carry the same disorder. So for example, if a husband and wife both carry sickle cell, we can make sure to find the sickle cell where it is in the husband, where it is in the female, or a sperm donor or egg donor, by the way. And we can kind of locate it, and then when we do the test on the embryo, we can tell which embryo has sickle cell and which embryo has nothing. And we only put back the embryo that's healthy, and all the ones that are affected and diseased, we put to the side.
Okay. Okay. Good to know.
But that's the genetic screening that is on the man and the woman,
mm-hmm.
not on the embryo. The one on the embryo checks for the 46 chromosomes, and that's when we know about for example, Down syndrome, because Down syndrome is an extra chromosome, number 21.
Okay. And so you can pick up on that before you even, do you usually like tell the patient that they had these ones that were not that great, or do you only tell the patient like you have, like once you get the good one?
So I usually tell everyone knows how many of their embryos were tested. So let's say you got 10 tested, and then the first thing I'll say is, I got your report and 6 of them are normal. So everyone knows exactly how many normal ones they have for the rest of their life. I don't give out the gender unless people want to know. So if they want to know, we give it to them. And if they don't want to know, we just don't disclose it at all.
Okay. Yeah, I feel like it's fun to pick your gender once, but I feel like, well, a question that I personally had was, so if we go through this process, we do the embryos, can you still get pregnant naturally after the surgery?
Absolutely. So whether you're freezing your eggs or making embryos, once your egg retrieval cycle is over, mm-hmm. there's a few really important things that you need to be aware. No one goes into an earlier menopause. You can get pregnant the month after on your own if you wanted to. It's not guaranteed that you will, but you can try. But people have the same chance they normally would. And it's not going to really affect anything, your overall fertility. Every month when you ovulate that one egg, that every one woman usually does, there's about 1,000 to 2,000 eggs that just naturally die off from that process. What we're doing by getting those eggs that are going to be either frozen or to make embryos is we're recruiting some of those eggs that we're going to die off anyways. So it's a big thing for us to be able to just take some of those and save them, and it doesn't affect the overall picture at all. Okay.
Okay, good to know. I have a couple more questions for me, or maybe one more question for me, and then I want to ask you some questions that I got from my followers, which are really, really good questions as well. But do a lot of women who do embryos still want to try first naturally?
Usually not.
Okay.
So we have two categories of women. So there's people that come in here, they're like, I'm just making embryos to freeze them for the future. And I get a call once in a while, they're pregnant and it's great. But I also have a lot of people that come in to make embryos for the future, but are also going to use one of those healthy embryos that they know are genetically tested and healthy to put back in them either like the next month or like 6 months or a year later. So it goes a long way to say that you have a healthy, beautiful embryo. And I guess it depends on how many you have. If you have a great number of them and you don't think you're going to use them all in your life, there's just really no reason to just save it. Why not use the healthy one then?
I was just going to say that. Yeah. I mean, if you're going to, I feel like you get excited when you're like, okay, you have 2 healthy boys and 5 healthy girls. I feel like, why would you, I don't know. I don't know if you'd want to get pregnant naturally because you know you have those babies in the fridge and you're like, well, I don't want to waste them. You might as well use them. And I feel like
absolutely, that's what most people do that. Most people do that.
Okay. Okay. So I have these couple of questions here. I know that one of the questions was, okay, so Jackie wanted to know, she said, should you go to a fertility doctor before deciding to get pregnant after you're 35? So if you're 35 and older, before you decide to, I think you already might have answered this because you said you should get your blood work done and everything tested, but I think she just wanted to know, like, should she just try to get pregnant or should she go to a fertility doctor first?
You know, I have to say, I don't think there's anything to lose by seeing a fertility specialist first. You will be very well educated. They are going to assess you and tell you everything that's going on. And if you choose after learning everything that you've learned not to proceed with the fertility doctor at that moment, you totally can. So I just think the place that it's very helpful is, let's say you're 35 and you do go and the doctor tells you your egg reserve is really low. So in a situation like that, thank God you went to the fertility doctor, because if you didn't, you would be in trouble.
Right.
Someone just said she's 41. You know, I think a 41-year-old, you go straight to a fertility doctor. I think anyone over the age of 30 should at some time or another have an assessment with a fertility specialist to see overall where they stand. And, you know, seeing Larry sitting there with you just reminds me of something. There are so many men that completely ignore this aspect of their life, just thinking that we're perfect and we always make sperm. But there are studies that have come out that men that hit 40 years and become older, the chances of having chromosomally abnormal embryos and miscarriages and autism, all of those things have had some link one way or another to older sperm age. So we have a lot of guys that call our office these days just coming to freeze their sperm because they want to use that in the future. And I think that that's huge. And I think it's really, really smart to do so. It can't hurt at all. It's easy. It's not that expensive and very smart.
Wow. So the sperm can get old and tired too.
Well, sperm is continuously being generated. It takes about, from right now, 72 to 90 days later, every guy will have new sperm. However, the well-being of the sperm ages as well, and issues come up as the age goes along. The volume becomes less, the motility goes down, the count goes down, the morphology goes down. All of those things happen with time.
Okay. Good to know too. Okay. All right. So another question is Dijon. She said, I'm pregnant with my first baby at 38 and she's having her in January. But they do want to get pregnant again and they were considering IVF with gender and they want to have 2 twin boys. But she's been hearing a lot about the risks that if she does the 2 embryos to have twins, that if one of them doesn't work, most likely the other one fails as well. Is that a thing?
No, not really. So I guess it depends from clinic to clinic. For our clinic, as long as you're able to make a genetically normal embryo, your success rate of that embryo going to a live birth and pregnancy is something between 76 to 84%. If we put 2 embryos in, each one has an independent statistic of its own to do so. So one embryo is not going to affect the other one in a negative way, even if it does not implant.
Oh, okay, good. Okay, good to know.
And an embryo is microscopic. It's like a speck of salt, even smaller. Like you can't really see it with the naked eye.
Oh, really?
Yeah.
How tiny is that needle that has to? Oh no. Yeah.
It's so The needle is really tiny, really tiny.
Wow, because you have to.
And it's all done underneath the microscope.
Wow,
The needle's kind of like a hair.
that is crazy.
Yeah.
You missed a lot of interesting stuff, babe. I'll tell you later. Okay. Adriana is married. She's 30 years old. They're in no rush to have kids. Wondering, should she do any fertility testing right now? Are there any at-home kits for fertility testing? Can people, is that like?
I've heard of some at-home kits that companies send you. To be very honest, I'm not that familiar with them, so I'm not sure how well they are and how accurate they are. However, I think that you have absolutely nothing to lose by asking just to start off with your OBGYN, checking your AMH level and making sure that it's a really good number.
Okay. Keisha said, I would like to know what the next step should be after multiple failed embryo transfers, all of which were good quality embryos.
So there's lots of different things to check. I get these calls all the time when I'm doing second opinions for people like that. First of all, you got to know what clinic you're going to. Unfortunately, there's some great clinics and there's some not so great clinics out there. Okay. Two is, did you do genetic testing, or were you just putting these embryos back in blindly, not knowing if they're normal or not? So that's a second really big thing. Three is, did they check the lining of your uterus? There's something called an endometrial receptivity assay, an ERA cycle, when we check the lining of the uterus to make sure that it was prepared up to the exact hour of development before we put the embryo back. And that's one of the most common reasons why you put a beautiful embryo in and it doesn't implant. If it has been genetically tested, that the embryo needs to be put in at the right time of preparation. So those are a bunch of things that you could do. I probably, there's a lot of clinics that don't do the ERA testing, which is sad. Mm-hmm. And there's a lot of clinics that don't recommend the genetic testing on embryos because they think it ruins the embryo. That is definitely a clinic not to do embryo creation and genetic testing in if they think it's going to destroy your embryo and ruin it, because that means they don't know how to do it well.
Oh, wow. Okay. All right. I hope that I feel like that was a very good answer, and that should answer the question. I also had, you said something about endometriosis. There was a question from Tammy that was, she'd like to know what the impact of endometriosis on fertility. Does that cause any issues?
Yeah, absolutely. So I'm going to explain very quickly what endometriosis is. The lining of the inside of the uterus is called endometrium. And sometimes it grows and gets out of the lining of the uterus and it grows outside in the pelvis, like on the ovary or on your intestines or the pelvic walls. That's called endometriosis. It's really painful. So every time you get a period and your lining is coming out, all of those patches of endometriosis in your body also get inflamed and cause a lot of pain. It also can affect negative issues with your eggs. So what happens is that you can get a lower egg quality if you have endometriosis. It can also damage your fallopian tubes so that they don't work very well. So all of these things can happen a lot. And for that reason, I think it's really important, if you are suffering from endometriosis, to talk to a fertility specialist and make sure that you can potentially be getting pregnant and your tubes aren't blocked, and if maybe embryo creation is better for you. Okay.
Okay. And then lastly, I know that a lot of people have a little bit of concerns when it comes to how much it's going to cost them to do all this, because I feel like that holds a lot of people back. But is there and I've had multiple DMs about this, are there payment plans for fertility? Is there insurance that covers it? And I'm sure you get asked this a lot as well.
So this is our number one question. It's the thing I get DM'd about the most, and every topic and every patient education event. We're having one today at 4 o'clock Pacific. If anyone wants, by the way, it's complimentary. You can just have to register in our website. But there are financing options that the office has arranged to help people. We have gotten egg freezing, depending on your credit score, down to as low as $160 to $180 a month. That's for egg freezing. We are right now, September 30th was the last day of our egg freezing special that brought the price down to $6,400. And I am not sure if our business offices are going to continue it for another month or not, but I would definitely encourage people to see what's happening. We may be starting a 2-cycle egg freezing package for the next month because many people are doing this more than 1 month. So whether it's the financing option or the specials that we have coming and going, people have been taking advantage of them. If you do work for a big corporation, a lot of them, like Netflix and Disney and Apple and Snapchat, Google, a lot of these bigger companies, especially the more advanced tech companies, they have amazing coverage. Some of these organizations have $75,000 of coverage.
Oh, wow.
If your company has like Progeny or Carrot insurance, you should double check. But I would highly recommend reaching out to your insurance or the HR of your company to double check and see if it's covered. And if not, then we can help with the financing options that we have available here.
Perfect. Do you have any questions? I learned that
very informative.
I learned that not all sperms look alike. Some of them have like two heads, like a big forehead, and that they have to separate and find the really perfect looking sperms to put in.
And so is that the aesthetic look of the sperm have any correlation to anything with the with the baby?
Well, it has a lot to do with the well-being of the embryo. So if it's a very abnormal looking sperm, it's probably going to lead to 50% of the genetics, remember, of an embryo come from the sperm. So if you put one that looks completely abnormal, it's probably genetically abnormal as well. And we were saying earlier that either will not fertilize, or if it does fertilize, it'll fertilize abnormally. And in worst scenario, it'll probably lead to, if it even implants, probably lead to a miscarriage.
Oh, damn.
Yeah.
Wow. Okay, well, I have one last question just because it's some, and then I'll let you go because I know you're probably super busy. But I always thought that by doing this whole process, even if you just do, I mean, I didn't know how it worked, but I know that like once you put the embryo in or the egg in, or is there a chance that you could have twins just by putting one in? Like,
so yes.
Oh God.
So you do have the same chance of getting pregnant at home. Okay.
Okay.
So there is a 1% chance of an embryo splitting and making identical twins. Okay. It's the same chance if you got pregnant at home, and it's the same chance with your embryo as well.
Okay.
So
well,
if it happens, don't blame me. Blame Larry, okay?
Well, okay, so it has something, does it have to do with Larry because he has twins?
No.
And my dad's mom is a twin.
So twins that are genetic are not identical. They're fraternal. That comes from 2 eggs and 2 sperm, and they both kind of take the implant. That's the genetic, because it genetically, in the families that have twins, people release 2 eggs. Oh. Identical twins is when one big embryo, it gets big and it just suddenly pops into 2. So that's why their genetics are identical.
How often does that happen?
That's only 1% of the chance.
Oh, yeah. Can you imagine? I don't know. When you don't want twins and you just get them anyway.
you know what? You got to be careful what you ask for.
But you have twins, right?
These are my twins.
Yeah.
Yeah, knock out 2 birds in 1 stone.
Oh,
yes.
That happened to your wife?
Well, we have an older child. She's 11. And after the 11-year-old, we got pregnant and then had a miscarriage and did not get pregnant again for about 2 years. And after 6 months of artificial insemination, we decided to go ahead and do IVF. We did IVF, and like a few days before the embryo transfer, we decided we're going to put 2 back, not 1.
Oh, okay.
So we put 2 back, and we had a bunch of embryos left over, so we were great. And a few years ago, we just had a little surprise and got pregnant on our own. So I had my 3rd girl. My twins is a boy and a girl.
Oh my goodness.
Here, this is definitely when you're like a daddy.
I mean, look at them. Oh my God.
Yeah, everyone's here.
Such a nice.
Thank you. The little one's a little surprised, but she's the sweetest. So I have 3 girls and 1 boy.
Oh, I love it.
Oh, beautiful.
So cute.
You're going to be following his footsteps similarly.
You're right.
I love how people have this idea of how many kids they want to have, but honestly, until you've had a kid, I don't think you can ever make that assessment.
No, you're right. I always said I wanted 4, but I don't know if that's happening now.
It's a lot of work, and if we're still on Zoom 7 years from now, we're going to rediscuss that, because I don't know if I want to recommend that to anyone.
Yeah.
Oh my gosh. Well, thank you so much.
Yeah, it was great talking. I appreciate this so much. I did want to tell everyone who's watching, coincidentally today in 2 hours at 4 p.m. Pacific, is the SCRC educational webinar that we do. We do them every couple of weeks. It's completely complimentary. You just have to register. And if anyone needs anything from us, please let us know. But thanks, guys. I will be calling Larry very shortly to go over a special report. I just saw your name. I didn't see it, so I have no idea. I have a feeling, of course, it's going to be good, but I'll give you guys a call soon.
We'll see.
Cool. Okay, guys. Thank you so much.
Best. Thank you.
Thank you.
Okay.
Bye-bye.